Just gonna vlog like this. Oh man. Okay, so hey Taco, stop. I'm vlogging right now, please. Excuse me. You wanna say hi? Say hi. Hi. So cutie pie. I have to keep him away from me because he's gonna try to lick me. You guys could probably hear him licking. Guys, this is episode number 49 of the vlog. Crazy. I think it's I think it's crazy that I've been doing this vlog since the start of DPT school. And the fact that it's like really blowing up right now is blowing my mind. It's crazy. And you know what? The big difference in the growth of this YouTube channel is consistency, honestly. Like in the last 3 months it's been growing, and it's all thanks to you guys, for all of you who are supporting and sharing these videos. Honestly, I'm just trying to help everyone on a larger scale, so thank you again for all your support. Okay, so what has been going on? The last 6 weeks, I have been on break, just enjoying my time. That's when you saw my vlogs to Zion. And I just been making a lot of YouTube videos and changing up like where I want to go and refresh and reorganize my brand. So it's really cool to see that this YouTube thing and Instagram is really growing. And I am just really blessed to have blessed ones like you guys to support me. But we started our clinical rotation, and if you don't know, and this is why I'm in scrubs, and you never seen me in scrubs before, because now I finally have an inpatient setting for my internship. So this is a 10-week clinical rotation where I'm doing it at Kaiser Baldwin Park, inpatient acute. What's up, guys? I'm over here on, I guess, campus now is what you call it. But I'm on the home grounds of my new rotation, Kaiser at Baldwin Park. Beautiful facility. Wow, they even got a Starbucks right there. I'm supposed to go over to my rotations are in the acute settings, inpatient, but they told me to go to the outpatient setting to get my badge and all my paperwork done. So, oh wow, look, duck pond. All right, first day. I don't know why I'm pretty nervous. I think it's because I never had an acute setting before. So I was kind of going over some notes and things to prepare. But, it's the first day, so we'll see. Sink or swim, right? All right, today is day 2 of our learning. I'm on my way to my physical therapy spot. It's like 2 minutes before it's game time. Parking was insane today. Holy crap, the parking is really bad. Anyway, yesterday I learned that there are a lot of post-op knees and hips at our location, so I'll definitely be getting a lot of that. And the acute setting is still a little weird to me. It's a lot. We are jumping from floor to floor, 2nd to 5th to 4th floor, and all of that. So it's like, I don't know, it's kind of all over the place. So I'll keep you guys updated on what's going on. Okay, so today is day 3 of the rotation. And I guess before I went out today, I wanted to show you what I'm packing for lunch, just so the gang train don't stop, right? Okay, so check this out. I got a big jug of water here. I try to refill this about like 2 to 3 times at work. I don't know my schedule and the routine yet, so I'm not trying to drink too much water. So I found like 2 or 3 of those bottles kind of makes me pee when I need to. But then I think after I have a better understanding, I'm gonna drink more water because then I'll have my flow a little better, right? Here we go. We got my lunch. I don't know if you guys saw my Instagram story, but if you're not, you should definitely follow that, because I'm on a weight loss journey. I'm trying to show you how easy it is to lose weight. So it's just lifestyle, baby. It's just lifestyle. All right, so check out that lunch. Booyah, that's sweet mashed potatoes. And then you got the veggie mix, and then you got chicken in there, and then some spices. That's it. Some spices, baby. And then, of course, gotta still have some extra protein. I'm trying to get big, son. I'm trying to get big and lean. What else do I got here? So I have my backpack. I know it's pretty dope, right? I think it's actually a baby backpack. Don't ask why I have it. Coffee, right? I have my iPad in here, so in case I need to look up any kind of special tests or any of my notes. I have my clipboard. I would definitely recommend bringing a clipboard. And it's dope because now I have a bunch of notes that I have to understand. And the first day they just kind of tell you and tell you and tell you, and it's like, wow, like, what are you talking about? So it's a lot. Okay, yep, so that's that. I have my binder in here. This is a binder they actually gave me. It kind of shows like the floor map of Kaiser. It shows some diagnoses like Guillain-Barré and multiple sclerosis and what kind of signs and symptoms you should be looking at. And it's like a good healthy binder to have around for physical therapy as a student. And then go in here, of course, gotta have a goni because we're physical therapists. Gotta make everything objective. And what else do I got in here? I got some pens, highlighters, and my badge. Oh yeah, baby. Who's that handsome man? Huston Yee? Dang, his eyes are so small. Are they open or closed? I can't tell. Hi guys, I'm back. Alright, I'm in my skippity spiffy scrubs over here. DPT. He want that DPT, you know what I'm saying? First week of my rotations and acute inpatient is complete. How do I feel about it? Alright, obviously ortho outpatient is something that I'm more interested in. However, I see the benefit, and I also see how you also need a good level of thinking as well for your inpatient acute patients as well. So, you know, in every physical therapy profession, you're gonna have the same type of patients, right? So like in an outpatient setting, if you're near a certain area, let's say you're like, oh, you typically always see back and shoulders and neck, you know, kind of thing. So in here in my location, you're always and typically gonna see post-op knee, post-op hip, and that's pretty much what you're gonna get for your ortho cases. And then you'll have your medical cases like somebody who can't walk, someone with a stroke, altered mental status, and things like that. So those are the types of patients that I have been seeing. It's just crazy how, you know, after they get their surgery for their knee or hip replacement post-op, right, that they have PT and they're walking on it right away, and then they get to be sent home like on the day of. Like, what the hell? Like, it's crazy how something so invasive where they put in metal and all this stuff, and then it's like you're going home. Like, what? I don't get it. I don't get that. But it's honestly been a dope experience to be able to go through this. I think sometimes inpatient gets a bad rap, like, oh, it's inpatient, it's so boring. All you're doing is getting the patient to walk. And in some cases, yeah, I guess I could feel that too. But in other cases, there's actually a higher level of thinking in some sense that inpatient requires. Now, I haven't been able to get to that higher place, like strokes, critical care, like all those types of patients need physical therapy, and I'll eventually get there. But my CIs think that I am able to handle these post-op knees and hips and some medical cases at this time. So that's all I'm gonna do until they get the okay, till I could go and they feel comfortable of me going to critical care and strokes and all that other stuff. So higher level of thinking, what am I talking about? So normally when you would see ortho patients and you have their charts in front of you, there's honestly not too much to chart review. It's like, all right, they have surgery, or why did they get referred to physical therapy, and what are some of their comorbidities, and that's pretty much it. You might have some x-rays, some imaging, some MRI, blah, blah, blah. However, for inpatient, not only are you seeing all of that, you're also seeing their blood work. You're seeing the communication between nurses, practitioners, surgeons, doctors, case managers, social workers, psychologists, like all of these different professions. We call it an interdisciplinary team. And so all these people are for the patient. They're for they're on the same team as the patient, and basically their common goal is, all right, let's give this patient a good quality of life, get them back to whatever they were doing prior to getting admitted to the hospital, and if they need additional help, let's get them some additional help. But of course, with all of this like team and all these crazy communications going on, there are a lot of notes that you have to review, and so because you want to go to the patient and enter the room prepared with what's going on. So it's been a great experience so far to be able to see in detail of really like and put together all these different classes that I've taken, and to see it all come into fruition. So for example, like my cardiopulmonary class, I needed to know, all right, hypertension, what's high blood pressure, what are high hemoglobin levels, what are high red blood cell counts or low blood cell counts, or platelets, or even my other classes like neuro and neuro rehab, and thinking like, all right, well, you have a stroke, or you have altered mental status, or you're in coma, like how are we going to approach you, and how are we going to do physical therapy so that you can be better? So it's crazy, it's nuts, but it's chaotic, it's peacefully chaotic, I guess, in a fun way, you know. And I enjoy being challenged every day, and I enjoy that my CIs are constantly trying to have some critical thinking going on in this big forehead of mine. I guess there's a brain in there or something. But yeah, that's pretty much it for this week. Continuing to go for 10 weeks and on, and then finally I'm done with my last rotation. Man, sometimes I'm telling you, it's hard to get up. I know it's only been a week, but it's hard to get up, especially knowing that you're not getting paid, or it's almost like you're paying it to do it. So, whatever. All right, anyway, hope you guys learned something. Have a great one, you guys.